2010, the Lancet Commission on Health Professionals for the 21st Century prompted a solid movement from scientific-based to system-based learning. The World Health Organization Southeast Asia region adopted resolutions on transformative health workforce education to move forward the agenda at global, regional, and country levels. In Thailand, the National Health Assembly approved the National Strategic Plan for the Development of Health Workforce Education in the 21st Century, 2014 to 2018. A national movement is undertaken on a participatory and voluntary basis in a multi-professional manner with grant support to the National Health Professional Education Foundation. To achieve the transformative learning goal, an interprofessional education and practice is embraced as one of the key strategies.
Interprofessional education or IPE has been recognized as a necessary step in preparing a collaborative, practice-ready health workforce. IPE has been gradually integrated into the teaching and learning process to better prepare the health workforce to respond to local health needs. Thailand's Subcommittee on Interprofessional Education was established by the National Commission on Strategic Planning for the Development of Health Professional Education for the 21st Century, 2014 to 2018, to work on IPE in Thailand. The National Health Professional Education Foundation is working as the secretariat for the Commission. One of the key achievements of the Subcommittee on Interprofessional Education was the development of the Conceptual Framework of Interprofessional Education and Interprofessional Practice for Thailand. The IPE subcommittee members who worked on the Conceptual Framework of IPE for Thailand. The Conceptual Framework of Interprofessional Education and Interprofessional Practice for Thailand is comprised of 4 core competencies. First, role, responsibility, and respect. Second, learning and reflection. Third, leadership. Fourth, teamwork. Interprofessional collaboration of all professionals can be shared between education systems, IPE, and health system, IPP. It can effectively improve health outcomes. Currently, the framework is being revised to be more complete. According to the framework, the IPE subcommittee developed 6 IPE modules that teachers can apply in their teachings. IPE workshops. The first workshop was held for 20 participants on November 24th to 25th, 2015 in Kanchanaburi Province, Thailand. It was facilitated by Dr. Hideomi Watanabe, Dr. Bamsuk Lee, and Dr. Hiromitsu Shinosaki, Ganmar University, Japan. The second workshop was held for 30 participants on November 23, 2016 in Bangkok, Thailand. It was facilitated by Dr. John H.V. Gilbert, University of British Columbia, Canada. The third workshop was held for 50 participants on August 18, 2017 in Khon Kaen, Thailand, facilitated by Dr. Yanika Kowitlavakul, National University of Singapore. In 2016, the Subcommittee on Interprofessional Education IPE took leading roles in convening. The forum served as a platform for IPE discussion by inviting national and international experts including Professor Vichan Panit and Professor Dr. John H.V. Gilbert, University of British Columbia, to share knowledge and experience on interprofessional education. Inviting Director of Rasi Salai Hospital in Sisaket Province and the Interprofessional Education team from Mahasarakham University, Mahasarakham Province, to share their stories of interprofessional practice and interprofessional education in Thailand. To move the interprofessional education agenda forward, the Interprofessional Education Subcommittee worked collaboratively with universities in Thailand to integrate interprofessional education in health professionals' learnings. อุบลราชธานี University นเรศวร University สุรนารี University of Technology Prince of สงขลา University ราศีสไลย Hospital มหาสารคาม University and ละงู Hospital Professor Dr. วณิชา ชื่นกองแก้ว Secretary General to National Health Professional Education Foundation disclosed that
Currently, interprofessional patient safety and rational drug use have already been integrated in some health professional curricula.
IPE has been implemented in health professional learning in many countries, including Thailand for quite a long time. Now we just want to integrate IPE in all health professional curricula systematically. That is not an easy task. We need to make teachers understand the concept of IPE. However, our goal is to help health professional students from different professions understand and appreciate each other's roles, respect each other, take leadership roles, work as a team, and learn and reflect what they have learned together. IPE does not focus on only learning about health systems, but also societal, economic, and spiritual systems. Students can learn all these domains through the IPE approach systematically. Thailand is still working toward WHO recommendation on interprofessional education that health professionals' education and training institutions should consider implementing interprofessional education in both undergraduate and postgraduate programs. Currently, the Interprofessional Education Subcommittee is focusing on interprofessional education at the undergraduate level and providing support to institutions by arranging IPE research and innovation contests among institutions, providing partial financial support for IPE development for health professional institutions, holding workshops for health profession teachers. The work of the Interprofessional Education Subcommittee is contributing to the movement on the development of health professional education for the 21st century at country and global levels. WHO representative to Thailand, Dr. Daniel Kerstens, gave his comment on his agenda that I think one of the things that we can do is help to transmit Thailand's experience to the rest of the world, and also have to bring practices and best practices from the rest of the world into Thailand, so we can actually help to leverage the best practices around the world for use here in Thailand, and also to show Thailand's best practices to the rest of the world. I think it's the important role for WHO.